Good morning, everyone. It's really wonderful to be here. It's wonderful to be back in Japan and really excited about this conversation today. As we get started, I want to also mention that we had a convening last night of business leaders from around Japan focusing on exactly this issue. And I'll tell you a bit more about what we're doing generally and then why Japan in this conversation. And then I think, Jesper, you and I will have more conversation, right? So by way of getting started, I am going to tell you about the two institutions that are really leading this work. At Columbia University, I've been on faculty there for, well, I was giving a talk a few months ago, and I was in my head thinking, should I say I've been on faculty for 3+ decades or 30+ years? And I said 30+ decades. So it hasn't been quite that long, but it has been a long time. And was at Columbia for about a decade, was here in Japan for about 12 years. Serving on faculty at Keio University as a visiting professor, and then at Temple University, Japan, as an associate dean there for research. And returned to Columbia, and as Jesper said, set up our Center in Global Mental Health at Columbia, where we set up this mental health and work design lab, because what we were seeing increasingly as we were doing this global work was the opportunity to engage the private sector and the need to focus on workplace to address the broad issues around mental health and well-being in society. So the Mental Health and Work Design Lab sits at Columbia University and conducts research that is focused on building real data and real evidence around what to do in workplaces that will have real impact on mental health and well-being in society. I recently have joined One Mind, which is a nonprofit organization, and One Mind at Work is the signature program there that focuses on taking this science and bringing innovation and best practices to build best practice within the workplace. And the aim really is to get to a point where we have enough data that we can build a gold standard around workplace mental health and well-being, and some metrics that will be useful for organizations in terms of setting their own goals and benchmarks. And please keep eating, so for those of you in the room. The Japan focus, this work that we're doing is really a global effort. So One Mind at Work and our global mental health program at Columbia are collaborating to try to build this global effort to create a coalition in terms of Japan, a coalition of Japanese leaders who are both here in Japan and also the leaders of Japanese organizations who are working in the United States. So there are significant issues around mental health and well-being in the workplace in these global organizations that are run as subsidiaries, either the global organization in Japan or the Japanese company that has a mix of domestic, local hires and foreign hires. So working both here in Japan and with the subsidiaries in the United States. So why Japan? Well, big picture in terms of opportunity for Japan is ready, and there's lots of discussion within the Japanese business community about mental health and well-being. There have been a number of committed strategies by government and workplaces around mental health and well-being. So there's an opportunity. Japan business leaders are ready, and Japan has served as a model, as a serious leader in terms of business structures and business performance globally. And actually, Jesper, you can speak to this as the grand champion of Japan, as our Japan optimist, but really important in terms of the global workforce. But also, why Japan is that it's really a critical moment for Japan in terms of opportunity to stay strong and to have real leadership in terms of the global workforce. Japan is facing, I'm saying things that you all know, a shrinking workforce, which leads to intense competition for talent. And even in Japan, expectations of the younger generation are that workplaces will address mental health in a way that's very different from a generation or two ago. So there's real shift in the workplace in Japan. The other thing is that the data from Japan and from the Japanese workplace is that work is not working for too many people. So we know that Japan has one of the highest suicide rates among high-income OECD countries. And often the post-mortem on these cases is that there were work-related issues associated with precipitating suicide. The other thing is that when you look at the Japanese workforce, the data indicate that the Japanese workforce is reporting a significantly high rate of distress associated with work. And that is driven by the workload, the amount, the expected hours within the workplace, relationship issues at work, and the actual content, the way work is designed. And only 6% of Japanese report feeling engaged in their jobs. And this is a critical metric because engagement predicts voluntary turnover. So low engagement, you're much more likely to see voluntary turnover. Low engagement is associated with lower productivity. And so a key metric in a workplace is building a highly engaged workforce. And the Japanese data indicate that Japanese workers are way below the global average. To think about 6 out of 100 of your workers reporting feeling highly engaged, that's a really troubling culture and workplace environment. It is the case that we're seeing an increasing number of Japanese organizations that are implementing measures to support workplace mental health. But of those that are not, they're saying that they don't see that it matters or that it's important or applicable to their workplace, or they're not certain about how to go about it, or they don't have the expertise. So those three rationales for not getting involved or not prioritizing workplace mental health are, from our viewpoint, real opportunities, because explaining and providing the data about why and how mental health matters to every workplace is pretty straightforward at this point. The data are really, really clear about how workforce mental health and well-being is correlated with culture, is correlated with productivity, is correlated with performance, is correlated with higher levels of health, which is correlated with lower disability rates, which is correlated with lower costs. So all of these things move together. And uncertainty about how to approach the issues means, how do we bring education? How do we bring workshops? How do we bring training so that there's a confidence about approaching these issues and we can address this concern of lack of staff support, lack of expertise? And it's really important when we think just from a economic perspective, the cost of not paying attention to mental health in the workplace in Japan is estimated to be around 6 trillion yen annually. So that cost is around people dropping out of the workplace, people being at work, but not really productive at work. So there's a term that we use, people know this term of absenteeism, but there's this phenomenon of presenteeism, right? People are present, but just sort of shuffling around in the workplace and not really productive in their engagement.
Just to put this in perspective, that's about 1% of GDP.
It's a huge, huge cost. So that's really, significant. And so what I often say to business leaders who say, these are difficult economic times, we can't afford to pay attention to mental health, we'll pay attention to mental health when we have a little financial surplus. In fact, those are the companies that are paying the most. They are the ones that have the biggest cost, because the cost of not paying attention is actually much greater than the cost of being intentional about bringing mental health and well-being to the workplace. So at One Mind at Work, we have a member program, an organizational membership program that is really focused on empowering organizations, supporting business leaders around mental health and well-being, how to enhance efforts for mental health and well-being with science at the cornerstone of all that we do, bringing data to innovate and build best practices. For those of you working in the workplace and anyone working around HR today, in the US certainly, and in many places we hear that your inbox every morning you could wake up with someone soliciting you, selling you some new benefit, selling you some new program. But the question is, what really works and what's going to have real impact? And so the organization at One Mind at Work is really committed to bringing science to build best practices for real impact. And we do that by access to science and content experts, through education, webinars and workshops and training for workplaces, measurement, right? If you aren't measuring where you are, your baseline, and then tracking that, monitoring and reporting, it's very hard to make the case for spending the time and resources. So the measurement is really important. And in fact, most organizations that are doing work around workplace mental health are not measuring the impact at all. And so they're really vulnerable programs in terms of organizational sustainability. And fourth, we build communities. So building communities of practice. One of the opportunities here this week in the meetings that I'm having is there enough interest and support in Japan to build a community of practice around workplace mental health that will make use of these tools and bring a mindset and an opportunity for exchange of experiences, exchange of practices among organizations in Japan, which is really important because there's no way coming from the US that I can speak to exactly what's going to work in Japan. We really need to co-create this in any good global effort. It's a matter of exchange of local global expertise so we're not reinventing the wheel in every location, but we're also not missing the cultural nuance of the local space. So the framework that we use at One Mind at Work is what we call the 3 Ps framework. And what's critical about the work that we do and what we're trying to do and helping business leaders think about the opportunity is sort of a beyond benefits mindset. So benefits are really important. And even in a country like Japan, where the healthcare system is a national healthcare system, the reality is that working people get most of their information about healthcare from their workplaces. And they will go to their managers or their HR to inquire about healthcare services, regardless of the system of delivery of healthcare services. So workplaces are really important, and benefits are really important. And private industry can influence, even in a country that's got national health system, if the private sector speaks to a need of their workforce, that has significant impact on policies at a national level. So regardless of the healthcare system, individuals go to their workplaces to get information and to inquire about resources. And that provision of services is really important. That's where most organizations are most skilled and adept. But the real value, the untapped potential, this idea of building, unleashing potential in your workplace, it's not about the next benefit. It's about going upstream to protection and promotion, or what we say, how we do the work of work. How do you protect your workforce mental health? What are the risks and exposures that people are subject to? And as an organization, do we know what they are? And are we doing what we can to mitigate the negative mental health impacts of exposures to certain hazards or risks? And at the promotion level, are we building psychological well-being? Are we building coping, resilience, strengths that are going to enable the organization to actually manage difficult situations, stressful situations? So this 3P framework is about protecting, promoting, and then the provision of information and services. And pretty much what we see around the world is that right now, everyone's talking about the shortage of mental health providers, right? That's the provision of services. Largely, and there is a real shortage. We need to build capacity for that workforce. But if we were doing a better job upstream around protection and promotion, there wouldn't be this pressure on the provision system. And really what I say is we sort of have a mudslide right now, that what could have been addressed upstream, if we were doing a better job in terms of protecting mental health, promoting mental health and well-being, the capacity for the system to support people would mean that, first of all, people would seek treatment sooner, because you'd be in a culture where talking about mental health is okay, and they would seek treatment that's more appropriate. And what we have right now is people don't talk about mental health and well-being until it's urgent and until it's extreme, typically. And the average individual, from a global study, the average individual has mental health symptoms for somewhere between 7 and 14 years before seeking treatment. Now, imagine if you had an ear infection and you waited 7 to 14 years. Imagine if you had cancer and waited 7 to 14 years, right? It sets up a terrible system in terms of success for provision of care. So this upstream focus on protection and promotion is critical, both in terms of unleashing potential within an organization, which will increase, again, engagement, productivity, and so on, but also better outcomes. So your workforce is going to return to work or be able to continue in work at a much higher level. So the 3P framework is the big picture of how we approach this work. And then we look at these 10 categories with the leadership team of any organization. These 10 categories are across how we do the work of work, all have a mental health lens to them. So clearly starting with mental health strategy. One of the things that we see all the time, Jesper, is I meet with business leaders and they say, okay, we want to address mental health in our workplace. And I say, well, what do you want to address? And they say, well, mental health. Well, that's like saying, I want to increase productivity, but like, what does that mean, right? What are we specifically talking about? In terms of mental health in your workplace, are you concerned about disability rates? Are you concerned about recruitment? Are you concerned about productivity? Are you concerned about morale and cultural engagement? Are you concerned that you recently had an adverse event in your workplace and the individuals don't know what to do about it and it's draining attention and energy. Like, what are you solving for? If you don't know what you're solving for, as Yogi Berra says, if you don't know where you're going, you might wind up someplace else. So you could spend a lot of time and energy and resources that could be, they could be getting you where you need to go, but they could be completely, taking you someplace else. So getting a mental health strategy established. Leadership, how senior leadership engages around mental health and well-being has an enormous impact on the overall capacity of an organization to actually address these issues. If you have leadership that recognizes that the mental health and well-being of the workforce is significant and at the core of building capacity and strength, you are going to, it's a catalyzing energy for everything else you do. If leadership thinks it doesn't really matter, or if leadership thinks this is something that my CHRO, my Chief Human Resources Officer, will take care of and nobody else needs to pay attention to it, you're going to really be swimming against the tide. This has significant impact on culture. I mentioned the issues of culture. The cultural piece here that has to do with mental health is it a safe place? Do I work in a safe place to be able to address my mental health needs and to be able to talk about what the issues might be within a workplace? This is actually a very big issue in Japan because of the issues around stigma, the issues around a historical culture of hierarchy that has made it very intimidating for certain members of a workforce to actually speak up. So this is the organizational culture piece around mental health and stigma is a really significant piece that we're hearing from Japanese business leaders. Workforce involvement and engagement is about when we say, okay, as a leader in your organization, we're going to address mental health and well-being. If you decide that you're going to do that on your own and you're not going to have your workforce be part of that solution, it's going to flop. It's going to be a completely ineffective strategy. The example that I often give is one, I was consulting to a school district a number of years ago. And the superintendent of the school and the parent-teacher association decided that they needed to do something for the high school students. And they created a teen center. They built this beautiful teen center that had a big screen and a pool table. And none of the kids went. And so and they couldn't figure out why none of the kids went. And I said, well, did you ask them? They didn't ask a single student what they wanted or what would be interesting to the students. And that happens over and over and over again in workplaces, that leadership decides, we know what they need. They need training in this, or they need something, never asking the workforce what they want or need, or how it could be delivered to take advantage of the program. And so resources are spent, and there's very little engagement. So we hear over and over again from senior leaders that, well, we purchased this EAP program or we bought this benefit and nobody uses it. So getting your workforce involved in solving these problems is really critical. Work design and environment is around how we structure both the physical space and the working relationships. So this is one of the hottest topics in terms of mental health and well-being right now, coming out of the era of the pandemic. In a critical question is about remote working, hybrid working. Do we bring everyone back? How do we bring everyone back? How do we bring people back when we've been hiring for several years without paying attention to geography? So now we have a workforce that's all over the country, and we're saying they all need to come back in the office. So these issues of work design and environment are really critical and huge impact on people's mental health and well-being. Studies, for example, around job role and description and getting your work done, particularly as you go down the hierarchy of the organization, people lose a sense of agency. So people often feel like they have no choice, they have no control over how they do their job when you're in the sort of rank and file. And creating opportunities for people to define very simple, make very specific, simple choices about how they're going to get their work done increases a sense of agency and increases a sense of engagement. So simple things like in a hospital, hospital aides who have to deliver materials around the hospital, if they get to decide how they're going to deliver the materials, are they going to go to one floor at first? Are they going to deliver all of the bandages first and then they're going to deliver something else? It's so simple. It doesn't impact, it's not a cost to the organization, and it increases engagement. So lots of simple things in work design and environment that frequently don't cost anything, but require real intention. Of course, communications, right? How we talk about mental health and well-being, that's a topic that comes up a lot in Japan because of discussions around stigma, discussions around privacy. Can we talk about these things in Japan? There are cultural norms about what is private and what is shared in the workplace. How do you do that in a respectful way, in an informed way? Again, once you have leadership buy-in and once you engage the workforce, you're going to have answers to appropriate forms of communication. Training specific to mental health, the managers in most organizations are the first person that someone goes to when they've got a mental health issue. But managers are not typically trained in mental health. So they feel like they're being asked to provide some service or some support and have no idea what to do. And that gets us back to that other data point about not having the expertise. So training there for manager training, not to make managers therapists or clinicians, but to enable them to recognize when they might be seeing something that has a mental health component, and training about how to approach someone when they are concerned about the potential for mental health issues. And really to serve as an educated bridge to appropriate resources and services. Mental health resources and benefits, pretty straightforward. And related employment practices are things like compensation, promotion, harassment policies. All of these related employment practices have, when they're not working, the way you know they're not working is that are mental health symptoms. So people start to report distress, people start to report anxiety, people start to report depression, and then you start to see behavioral impacts like voluntary turnover. So dealing with the related employment practices is key, and then measuring, monitoring, and reporting, which, as I said, most organizations are not doing, makes all of this work really vulnerable. Should I keep going? Or
Keep going.
So some data here. Most organizations, one of the things that we're seeing is that only 1 in 4 organizations actually has a strategy. So that's a huge issue and a place to start. What do we as an organization identify as relevant to the mental health and well-being of our workforce? Get a definition out there and begin to articulate what that could look like in terms of your workplace. Because without a strategy, you're not going to know, you're going to be spending a lot of resources in an ad hoc kind of way that won't add up. Most organizations are not doing their work strategically, but we know that those organizations that actually do have a mental health strategy are at about a 54% higher overall program maturity across the other categories of function. So once you start with a strategy, it cascades into all of these other components of what you can be doing in the workplace. And as I mentioned, most organizations are not focused on these upstream efforts in terms of protection and promotion. 65% of organizations do not have a system in place for identifying psychosocial hazards that may pose risk to worker mental health. If you don't know where your workforce is at risk, it's very hard to protect them. Right? So applying a risk analysis and a risk assessment to your workplace will help define where your strategy needs to be and what's going to have greatest impact. And we know that the data that are emerging globally are consistent over and over again. The old mindset that we need to continue to extinguish is either we are a high-performing company or we pay attention to mental health. The truth of the matter is that every study will show you that these move together. They're not in opposition to each other. So if we pay attention to mental health and well-being, we're going to see improvements in terms of productivity, in terms of performance, in terms of reputation, which impacts recruitment, which impacts retention, and so on. So organizations that score highest in the above the target score on this assessment. So all of this information we have put into a leadership tool that we call the Mental Health at Work Index. Completing this assessment in a structured way takes about an hour and a half or so for a leadership team to come together and complete the Mental Health at Work Index. You get your scores on all of these categories, but you can benchmark your performance to a standard of what a gold standard of mental health at work programs would look like. So what does a good program look like, a standard of excellence? And what does the global benchmark look like? So you can compare yourself to other companies. What we're hoping to do here in Japan is have enough organizations complete the assessment so that we can create a Japan index, because a Japan benchmark, because everyone wants the global data, but organizations also want to know, how does my company compare to my peer institutions? And particularly in Japan, what does Japan look like, right? So what does my company look like compared to other organizations operating in Japan, and then compared to the global index, or the global benchmark? So when we look at the data thus far, we can see that organizations that meet the target score at or above the target score on the Mental Health at Work Index have 90% of their employees are likely to recommend their organization as a good place to work, which again comes back around to this issue of recruitment, retention, and reputation, and other metrics along those lines. So this as an example. So the opportunity that we have here in wrapping up is there's a huge opportunity of thinking about focusing on, not only thinking about, but actually activating on addressing mental health and well-being from a strategic perspective to enhance workforce mental health, which will have a dramatic impact on organizational productivity and overall performance. There's an opportunity to leverage global expertise and to bring local experience and build culturally relevant solutions without having to completely reinvent the wheel, but actually to leverage what we know globally. It will have significant impact on organizational reputation, organizational performance, and do this by building a community of practice here in Japan. So, so one of my colleagues who is now this morning at the U.S.-Japan Council meeting, so not here, but Haruka Kokaze is working very closely with me in building this Japan coalition here in Japan and back in the U.S. And we welcome your engagement, input, and conversation. Here's a QR code if you want to learn more.
Wow. Well, Kathy, thank you. And absolutely fascinating. Lots of, insights and sort of creating the evidence, right, around, mental health, ultimately employee happiness, employee engagement. Sort of, does it vary by industry? Manufacturing, as you know, in Japan, they're very proud about the craftsman and the precision in the manufacturing versus, for example, a hospital versus the service sector. What does the evidence show? Is it pretty uniform across industries, or are there differences?
Yes. So there are certain industries that are at particular risk at this moment in time. And there are, even within every industry, there are organizations that are doing better than other organizations. So industries that are at particular risk right now, where there are very high levels of mental health issues, very high levels of disengagement and burnout and voluntary turnover, are healthcare. Healthcare is a really serious issue. It's part of the shortage that we have in terms of service providers. Finance and professional services, expectations around workload, around travel, around 24/7 availability. One of the things that we see a lot, or that I hear a lot as I work with organizations, this is the first time historically that we've had 5 generations in the workplace. Right? We've got a very wide spread of generations, and if we go up to our boards, maybe it's even 6 generations. Right? So you've got members of the board who could be, let's just say, 75 years old, and then you've got your first generation worker who is joining a company at 25, right? So you got 50 years. If you go back 50 years, like the person who's on the board, they started work, they were in that position 50 years ago. Okay, think about what the workplace was like 50 years ago. So we hear from board members, oh, we have these delicate flowers, right? I don't know if that translates in Japanese, but that's a very common expression now in the workplace. We have, a generation that doesn't want to work very hard, an entitled generation, because they're saying that they're not going to take calls on their cell phone on Saturday and Sunday or something like that. But 50 years ago, when that board member was in their position, there were no cell phones, there was no internet, there were no emails, there was no FedEx, there was nothing of what we have today in terms of there were default boundaries that protected people. And so what we're seeing in industries like professional services, the legal system, the financial systems, they've always been hard driving, high performing, industries, but the pressures now are enormous, and we're seeing high rates of attrition, and that's really expensive.
Right.
It's really expensive. If you think about the cost to a society to educate a doctor, and that doctor opts out of practice at age 40 instead of age 65. That's very, very expensive. So healthcare is a big issue, professional services, and you mentioned retail. The group, going back to this issue of psychosocial risk, Within retail, the group, you need to segment your workforce. And the group that is actually on the floor, right, is actually in the store, is subject to very significant elevated risks in society today. And maybe less so in Japan than in other places. But in the US, that segment of the workforce is really vulnerable, not well supported often, and the mental health issues are very significant. So yes, it's
funny that you mentioned retail. I think all of us are aware that Japan just passed legislation, right? Customer harassment, right?
Right.
And it's exactly the face-to-face, right? The expectations. And also the assumed agency that the customer is king, right? But how does that relate to the service provider?
Yeah.
Is obviously an issue that people are grappling with here. Now, you talk a little bit about the sort of cultural differences, right? I mean, there's the American, whatever that means. There's obviously, how American is Amazon? Quite frankly, I do not know. But there is obviously this idea, and it's because of the labor laws and the labor rules and regulations, which obviously differ very much. Hiring and firing comes easy in the North American concept. It doesn't come easy in the Japanese, or for that matter, in the European context, right? So these sort of cultural differences. How do you, in your assessment and creating the evidence, are you primarily focused on Japan and the United States, or are other cultures coming in as well?
This is a global effort. So we have, at One Mind at Work, our member base is a global member base. Probably half of the organizations are American, but many are multinational corporations headquartered in a variety of places. As the membership grows, we have 125 plus or minus members and affiliates. We're focused on building communities where we can define regional groups, because, in fact, to your point, issues around regulation and laws and policies have an impact on what companies are doing. So we're aiming to build this coalition in Japan. We're working with Singapore. We've got an initiative underway in Portugal, where there's tremendous interest in workforce mental health, Scotland, Spain. So regionally, we're building out these communities of practice and trying to build a sufficient engagement so that there's not only a community of practice, but a benchmark for that region. The issue that you raise around regulation is one that is many layered, I think. One of the things that we talk about in healthcare is that, and I think it's true across many industries, most leaders, once you get to a certain point of leadership, the regulations feel like a burden, right? We've got to do this, and we've got to do that, and we've got to do this. We talk about this in healthcare. If we could set standards for ourselves, right? Regulation doesn't come in until we fail to regulate ourselves, right? Regulation, it's a big job to get a policy passed around the labor law right now and for the workforce in Japan. That's years in the making, right? And so if, as business leaders, we are effectively addressing certain issues, there's less regulation. If we continue to fail to do it, there'll be more regulation. So it's this dance of leading that will set standards. And if we can do that more and more effectively, there'll be less burden in terms of regulation. But at the end of the day, the regulations help a lot in terms of requiring minimum standards of practice. And so we see very different regulations in different countries that then impact workforce mental health differently. So in the US, it may be easy to fire people, but it's only easy to fire people if you do, a big RIF, a big reduction in force. If you have someone who has a mental health issue and you can't fire them individually for performance, right? So it becomes very complicated. And if the strategy in the US is that every couple of years we're going to do a big pruning and reduction in force, that has a huge impact on the people who remain and the mental health issues there about culture and vulnerability and engagement and all of those things.
I mean, it's so interesting because it also, then corporate size
That's
also
right.
makes a difference, right? Which goes to the agency and what, dare I say, Karl Marx, alienation at the workplace, right? Because if you and I set up a little partnership, that's awesome. We're having fun. We know exactly what we're doing. We're family. We take care of each other. We grow, and all of a sudden it becomes process oriented, and all of a sudden alienation, and loss of trust, actually starts to creep into the system. So it's a fine line.
It's a very,
very fine line, that you sort of have to work through, right?
Yeah.
One of the things that was very interesting that you said is, do you know this 500 organization? This is a slightly different issue, but it comes to your point about that the management, that the leadership actually has to own and live the issue. And this is an organization that is not mental health, but is disabilities, right? People with disabilities. And what this organization does is it gets the commitment from the CEO, from the chair of the board of large Fortune 500 companies, to commit that at every board meeting, you will at least in one item talk about disability and people. And so if you did that, right, if you had the commitment from the CEOs of the leading companies that at least one item on the board agenda is going to be addressing mental health within the corporation, you would get the trickle down because everybody will know, oh, what do they talk about in the board meeting?
That's right.
If they know they talk about mental health, you get the positive feedback loop very quickly.
Your point is so on the mark. We are currently doing a study with boards, and we're interviewing people who sit on publicly listed boards in Australia, the UK, and the US to start. And we picked publicly listed companies because they'll have a certain standard of expectation, right? And what we're finding is that it's nowhere. Mental health is nowhere on the board agenda. And when I speak to these board directors, they all personally are aware that mental health matters, but they're like, no, it's not part of our orientation. It's not in any of our board packet material. It's not in the board education. It's not on any committee. It might come to the board if there's an adverse event, but maybe not if the CEO feels that this is an operational issue and not a governance issue. So it's a huge, huge issue because if the CEO is between a rock and a hard place in that he's got the new employees coming in saying, you need to pay attention to the mental health and well-being of us, and we want these certain considerations or this to be part of our organizational culture. And then you've got the older professional who grew up at a completely different time that never spoke about mental health and well-being in the workplace and doesn't get it and is, what does the CEO do? And so we are in the process of trying to work with boards and there are a number of organizations that work on board training, board education to make a set of recommendations around where would mental health and well-being come into a board governance role. How do you think about mental health? A lot of strategies in the workplace is to get mental health to kind of ride on the tails of disability, because you can say that mental health issues are in the same sort of related camp as disability and come under that umbrella. But how do we get it onto a dashboard for the board? How do we create a dashboard? How do we create a board training? How do we advise boards on where mental health and well-being should sit? And what's coming out, I'd be curious what people think, is there's a general consensus that it would either sit on sort of compensation, because the comp committee frequently is all the HR issues, or risk in the risk committee, and wonder what people think. But that's what's starting to emerge from this study. So we'll have those results actually after the new year. And when we'll have a number of meetings in Japan in the coming year, maybe we can present some of those data, or if we can get enough Japanese board members to join us, we could have a Japan conversation on what that should look like.
Let me ask a slightly aggressive question, right? What's wrong with this Gammanste? Suck it up.
Yeah.
This is a very hard question, right? But I'm sure that
we hear it, yeah.
You get it. And certainly, if I go out with my, fellow leaders who are 60 and 70, that's the response,
yeah.
Right? So how do I counter that?
Yeah. So what I say, I don't know if anybody has seen that, I think it was actually, I don't know what software system it was on, but I got it as a little clip of the woman coach, basketball coach, who talks about doing hard better. And so that's what we talk about, because,
doing hard better. Okay.
Because finances, being at a place like Goldman Sachs or JP Morgan, it's not like that's going to become a walk in the park, right? It's always going to be a hard driving organizational culture. Being a senior partner at a global law firm, running a cardiac unit, right? These are hard jobs. They're real pressures. And so what we reassure those folks is this isn't about not working hard. It's about catching up to the times and being able to do hard better today, because the world is different today from when they were working very hard at their jobs. So what are the updates that have to happen to be able to do hard better? Because they were successful in a certain context, a certain cultural context. What can they do to support the success of the next generation, so that the young person today, who in 30 years is going to be sitting in their seat, or 40 years, we need to prepare them. They need to be successful, right? So how can we invest in doing hard better in a way that makes sense for the cultural demands and the cultural context of the world we live in today? That satisfies some people, and some just drink some more beer.
It is very interesting to me that you and I have a lot of sympathy with this, that you sort of play up the generational divide. I'm actually more skeptical on this, in the sense that I think if you look actually at the old generation, that they also had lots of issues, right?
Lots of issues.
That the issues were being dealt with in a very different way at the time there. Now, elevating, the transparency about this. This is okay to talk about, right? There is a system, that actually, allows the transparency and the openness, and also a system that includes mental health and the mentorship that the leaders of the organization provide in the evaluation system, right? I think that that's progress, because it was just done. In the good corporations, it was just done, but it wasn't measured and monitored, while you're introducing measuring and monitoring to this, which gets me to the next point, right? And, AI, You're creating a measurement system, you're creating a library, you're creating the perfect toolkit for an AI to provide the solution. So if I'm a manager, right, I look at this and say, great. So now if you've got a mental health issue, just log on to this website and you'll get all the answers.
So AI is a hot topic in mental health and well-being, really hot topic. There is no question that there's huge opportunity to leverage AI to address mental health issues more effectively, from diagnosis to gathering sufficient data to know when we've got a good diagnosis, what treatments work, and to use big data to actually build more refined strategies that are person-centric. Most mental health conditions, if we talk about the common mental health conditions of anxiety, of depression, those are the two big mental health conditions that are most common in the workplace. And then non-clinical diagnoses of stress. There are lots of pathways to that phenotype, right? To that clinical presentation. How I got to feeling anxious could be driven largely by early childhood trauma, could be driven by biology, could be driven by a health condition that I've had that's affected my nervous system in ways that really really amplifies anxious response, because there's a biology to being anxious and there's a biology to calming one's body, and that is driven neurophysiologically, right? So there are lots of pathways to anxiety. Using AI to refine and have a better understanding of the symptoms that we're seeing and the pathways there will help specify the treatments, right? So if it's an exposure, I've been exposed to repeated physical violence as a child, that's going to have a psychological component, it's going to have a physiologic component, it's going to define, it's going to direct what treatments might be most effective. If I've had a recent traumatic event and don't have a history of anxiety, but now I'm having panic attacks, that could be a different opportunity. So there's huge opportunity in terms of AI helping refine what we're seeing and what treatments are going to work. The problem is that we don't have the databases structured in a way just yet that can provide that information. So part of our goal, for example, in gathering enough data here is that over time, in addition to collecting data on what are organizations doing, in the Mental Health at Work Index, we collect data on performance indicators. So what are your data in terms of your Net Promoter Score? What is your data in terms of disability? Your data in terms of absentee rates? 12 proxies that are related to performance. Using AI then to say, okay, let's look at all of this data and tell us what really matters in terms, what's going to have the most leverage, what's going to have the most impact in terms of improving overall performance and overall mental health for our workforce. That's a great AI question, but we don't have large enough databases for that to be. The thing that AI can do is computation of a lot of data points fast, right? And compressing that data. And we don't have that within mental health yet. It's happening in certain countries that have sophisticated national registries. It's happening, it's starting to happen around guidance for clinical care. It's not replacing clinical care. However, I will say that in Asia, where there's been a stronger boundary that is largely related to stigma, but also culturally, the privacy issues that, for example, in China, there's huge uptake using AI generated chat that is supporting people who are more comfortable texting with a outside anonymous data-driven, we hope, response system that for supporting mental health needs. At the end of the day, it's pretty clear that AI will be a tremendous aid to supporting people in addressing mental health. I think there's a significant risk of thinking that AI is going to eliminate the human factor, because in fact, it's the human connection and human factors piece that has such a huge impact on our mental health and well-being every day. So the strategy, I think, is not about eliminating that, it's about leveraging.
So it's funny, like, I mean, sometimes on that, I mean, there's so many issues, and the privacy issue obviously is absolutely enormous, right, in the whole thing, because if you become stigmatized as the person, she had a car accident when she was 6, and as a result of that, there are certain issues that, this gets very different. But I like your decompression. I mean, you and I, when we had pressure at work, we went to a bar and had a drink, and that was our decompression. And if the new modern version is that I chat with an AI, right, to get my release, then so be it. Right. But absolutely fascinating. From the floor and from our people online, any questions for Kathy, please?
Thank you. As an ex-employee of a company who told me "ganbatte" all the time, I realized that sometimes the company who is fully highly aware of this risk management and mental health issues, and they have provided several workshops and several educational programs, but sometimes it doesn't work very much. And what happened to me was it was a huge workload, and then I expressed in several ways, but it was never heard. But when I once realized that I was pregnant, and then when I mentioned that, they said, then we will take care to have less responsibility, which was not my request. However, that was their solution. And then after 3 months, I miscarried. I had miscarriage. And then when I mentioned that, I'm sorry to hear that, and we will give you less work, which I was not respecting. But when this kind of something that not working from the employment point of view, I was wondering that I have a question that if there was something I could do as an employee, because now I've been working I had worked for 16 years, tried to change the company, but it was so difficult. So I left the company, but I've been thinking that was there something I could do as an employee? And that is my first question. And then second one is, now I left the company and I've been working with a company who is actually interested in working on this kind of problems through art activities, like cultural use of cultural activities. And I'm wondering, to use this kind of mental health, to work on mental issues, is there any good examples or how the culture or contemporary art is affecting, or did you have a good example? I don't know. Yes. Thank you.
Yeah. So the first point that you make about organizations' response, many organizations are still in a mindset. We go back to the 3 Ps, right, of protect, promote, provide, when an individual reports that there's a certain condition, right? It's all about the way to address mental health at work is by addressing this individual's mental health needs. And it's typically the favorite response or the favorite program in most organizations is a program around building resilience. Right? And I think like organizations, you can only become so resilient, right? The mouse can only run on the treadmill so fast. And no matter how well you train, there's a like a maximum function, right? And then you have to think about the environment. And organizations are still highly focused on individuals and let's fix what's wrong with you, rather than a holistic approach to let's understand our workplace and how we as an organization, the environmental conditions of how we do the work of work are part of this story and how you are part of a cultural context. So that's a shift that we're very focused on as we work with leaders, is to broaden out how they think about the target of approach when there's an issue that's raised. Yes, let's support this individual, but let's understand this individual in a cultural context. Let's go upstream and look at protection and promotion in a big picture. So that's the first issue that you described that's very common, but changing, hopefully, bit by bit. The second, around lowering the work expectations, is a complicated one in that Japan actually has a pretty well-established strategy of if someone has work-related stress, a protocol around creating a less stressful work situation, but keeping them employed, right? And there's actually a significant wisdom in that, because enabling individuals to stay employed when they are experiencing a increase in mental health symptoms can be very supportive and actually clinically very helpful, because staying behaviorally engaged and activated is really useful versus putting someone out on disability and sending them home and asking them to come back in 3 months. So there's real health benefit to that, but it can also have the negative consequences of what you're describing, of feeling like that isn't what you asked for and that isn't what you needed. So it comes back around to this idea of workforce involvement and engagement in solution building. You need to talk to your people about what they need and what they want and what will help them. What could you have done? What we are encouraging and supporting with lots of organizations is building out employee resource groups. It's very hard as a single employee to shift the culture of an organization. However, employee resource groups that bring together employees around a topic that is of shared interest starts to build significant capacity to have and voice. And organizations that we work with are frequently reporting that the fastest growing employee resource group in their organization is around mental health and well-being. And once you build a voice, then you have a employee lead who gets a voice to speak to managers about what they're hearing from this employee resource group, and you can begin to be part of solution building and build a force that can have impact. It takes time, but there's real demonstration of the potential for employee resource groups to have a real impact on shifting culture in that way.
Robert Dedarick, Temple University. Thank you very much, Kathy. Two short questions. First, has suicide always been higher in Japan than in Western countries? Secondly, you mentioned finance in areas where young people work very hard. Now, my impression, both from talking to younger bankers and from reading the press, is they're actually working harder than when I was there 40 years ago. But at the same time, for every single position at Goldman Sachs, there are 1,000 applicants. So it still seems that it's rather popular.
Yeah.
So,
So that's right. So they are, because what's happened over time in workplace is, going back to this point that I made earlier, the default settings in the workplace have shifted so dramatically that boundaries around amount of work, expectations of availability, pool of candidates, all of that has changed significantly because of technology, largely. So Goldman Sachs, for example, or any other investment bank, in terms of pool of candidates, the cultural commitment over time to increase access to education has happened largely because of technology opportunities and a commitment to increase access to training programs, has all been multiplied by technology that enables somebody from a small town in rural Japan to get online, to apply for some program, to be an intern. And that's all really good, but it does mean that you now have a diversity, there's a capacity of interest, or there's a pool of interest that just continues to be significant and large because it represents opportunity, right? So there is this tension that we see that there's a pool of individuals who are going to apply to these jobs that we're describing as hard driving, difficult jobs. So there's not a shortage in some ways around who wants those positions. However, once an organization invests in people to join that organization, the cost to the organization of training someone and then losing them after 3 years is really significant. They build that in a little bit, right, in sort of a predictable attrition rate, but it's significant to organizations. And what we're seeing, even in these prestigious organizations, is higher rates of attrition, higher turnover rates. That's really expensive. And I just spoke to someone at an investment bank who was prepared to promote this rising star, brought him into her office, and he said, I've decided I'm done. I'm going to go backpacking for 6 months, and I'm going to find some work that is really different from this. And he went off to do a yoga retreat, and she just could not understand what happened. So what organizations are seeing is really talented people saying, you know what, I'm out of here. And that becomes a real issue. So what we're seeing now, actually, is a lot of the individuals who might have applied to these traditional prestigious institutions are now in the whole startup world, right? That's where that energy is going because of the opportunity and the flexibility and a lot of these mental health issues. So we're going to see a lot of movement in this way. You're absolutely right that the bank can say, you know what, we got plenty of candidates, have fun on your backpacking trip and, send me a postcard. But over time, they're going to be losing the reputation for recruiting the best talent. It's just very clear.
And Robert, this is very interesting because, this is starting to accelerate in Japan. Mm-hmm. If you look at the churn rates, right, and you segment it, 20s, 30s, 40s, right, it's actually interesting that across all groups, right, the churn rates at the K-down companies are starting to pick up. It's from a very low base, right? But, and it's not always about mental health, right? It is for a whole variety of reasons, but this is something that particularly here in Japan, because it is an employment and leadership model that is primarily based on seniority, right? To not take these sort of soft factors, into account, these soft factors are going to become more and more important. And it's going to be amplified by the fact that here in Japan, the number of Keio, Todai, and university graduates in general is shrinking every year. So the war for talent and the toolkit, ultimately, the toolkit that you as a CEO or you as a leader of a Japanese corporation needs to be able to employ, right? These soft skills and the systematic approach to something like mental health, I think is going to become more and more important. So you're in the right spot. Japan is going to be a growth industry.
It's going to be and just one further point, Robert, to underscore, to go back to this idea about doing hard better. You can be in one of these organizations, and there are teams that are being run at all of these hard-driving, high-performing organizations where people are flourishing. And it really, there's an expression, right, within the workplace is that people don't quit a job, they quit their manager. And when you've got a team that is really structured in a way that takes into account the range of individuals on the team and the needs of these individuals, you can be working really hard. You can be doing all kinds of, making all kinds of decisions, choices around your workload and engagement and be flourishing. So it's not, again, it's not about we pay attention to mental health or we work hard. Sure. It is about how do we do this in an integrated way so that we can pay attention to our mental health and engage in an optimized way to work hard and flourish.
Excellent. We've run out of time. I apologize. I think we can continue the conversation afterwards, but I want to thank everybody for coming out. I want to thank Kathy for such a very, very detailed and passionate presentation. I hope that we can continue this as your journey into Japan, into corporate Japan,
right?
Sort of evolves over the next couple of years. You certainly have a partner, with the Asia Society here in Tokyo. I want to thank everybody online.